What is the social situation? Social care workers work with individuals and families to help improve outcomes in their lives. This may be helping to protect vulnerable people from harm or abuse, or supporting people to live independently. Social care workers support people, act as advocates, and direct people to the services they may require. Social care workers often work in multidisciplinary teams alongside health and education professionals. Social care workers meet people from different backgrounds with a range of needs. They specialise in social care and are not necessarily experts in autism. What can you expect? Social services carry out social care assessments. The purpose is to find out what help and support you may need to be safe and live well. The assessment will usually take place where you live, but you can ask for it to take place elsewhere. Support may or may not be funded by social services. Social care funding depends on your financial situation. The social care worker will meet with you and ask you about your needs. They use a social care assessment to guide their questions. The social care assessment can be done by a social worker or a community care officer. They are usually called the assessor. The assessment is person-centred, and it means you are expected to work together on the information. The process has different parts: assessment gathering, decision-making, and review. Unspoken rules. An unspoken rule is that the assessor is an expert in the Social Care Act and the types of support that can be offered. You are an expert on your own situation, and together you will be expected to work out what your needs are. The assessment will be based on the information the assessor gets from you and the people who know you well. It means that unless they have been shown or told, they cannot take the information into account. Each assessment can take variable amounts of time, depending on the type of information and the situation you're in. An unspoken rule is to help the process by being as succinct as possible. The reason for this is that social services have to assess and support large numbers of people, and often need to see more than you on the day. It is helpful to prepare information, but once you have more than 2 pages of information, it stops being helpful to the assessment. The assessor may not be able to tell you whether you meet the criteria on the day. If you are not eligible, it does not mean that the social worker does not empathise with you. It can mean that according to the national criteria, your needs do not meet the threshold for funded services. Other practical unspoken rules are to offer the assessor a drink and not to smoke while they visit. Turn off your TV or computer while they are there to help everybody's concentration. By turning off your TV and not answering text messages, you show the assessor that you take the assessment seriously. And finally, if you have pets such as dogs, it is polite to move them to a different room when the assessor arrives. Challenges for autistic adults.
With autistic adults, there may be a situation where they cope incredibly well. For example, when they go to work, they can have a very successful career, and so that will be seen by people outside that they're coping incredibly well. The problem occurs when they go home. Maybe they just can't tidy the house properly, or they can't get their calendar organised, so they don't know where they're going and when they're going, and so they may end up being late for appointments. This is just because they have learnt different ways of coping. Okay, some autistic adults may find it hard to actually communicate with the assessor, and they may actually give way too much information, so details that aren't even important to the assessor, just because the adult can't decide what is useful for the assessor to hear. Or you could have a situation where the autistic adult is very quiet and they probably don't actually say enough that's helpful for the assessor and to get the help they need. An autistic adult may find it hard to focus on the information that's required. Okay, in an assessment, it may be that the autistic adult doesn't feel that they want to give information because the assessor hasn't actually given a direct question. So, for example, it may be, can you cope with your housework? And the person would go, yes, of course I can. But actually they haven't hoovered for about 3 weeks. and it's getting rather messy and a bit unhygienic, but to them that's okay because they weren't asked a direct question. They didn't really know what the answer was going to be. During the assessment, the autistic adult may not give the proper information based on historical evidence. For example, if they're feeling very low mood the day before, they wouldn't necessarily give that information during the assessment because they might be feeling a lot better that day. An autistic adult could have a situation where they believe that they're coping fine with their, say, housing. Maybe the heating's not working properly, but they're okay with that. They haven't realised there's actually a problem. But an outside agency like a social worker may get concerned because obviously it's not a very healthy situation to not have heating.
What can professionals do? Give the individual or carer a list of questions to be covered. This helps them to prepare and to think about their needs and the outcomes they want to achieve in their day-to-day lives. Ask specific questions. For example, this question is about your self-care, or I am asking about your mood and well-being. Many people struggle with open questions such as, what would you like help with? Be prepared to offer suggestions for what they might need help with. Be prepared to give handouts about key information, including your decisions. Ensure your information meets the 2016 Accessible Information Standards. What can the autistic adult do?
You may have to be prepared to actually change your behaviour just for the assessment. For example, if you're someone that does actually talk an awful lot, not always on the actual subject you're meant to be talking about, try to stick to the point and do speak a little bit less. Interact with the assessor and try to go with the way they're behaving. The other way is if a person doesn't actually talk very much, you may have to have a go, just try it out, see how you get on. If you've actually have problems with eye contact, don't worry about it, just tell the person what you want them to hear. A very useful tip is to actually prepare a list so that you know what you're going to talk about to the assessor and you stay on your subject. This can be important because you don't want to talk about the dog walk that you did that morning. You need to tell them about the situation that's causing you difficulties. You need to actually tell the assessor all the areas of your life where you need assistance, but you may actually think you're living more independently than you are. Your parents might actually come round once a week and take you shopping, or they could help you make sure your budget's okay so you don't overspend on the money that you have. This isn't actually independent living, you are getting assistance, so you need to make sure that the assessor is aware of this external help you're getting. You need to be aware of how much time that you'll have with the assessor. This is important because you need to make sure that you say everything that is important. You will probably need to check with the assessor when they first arrive, because say you've got half an hour, you need to ask maybe halfway through just to say, is this enough time for me to get all my points across? Do you think I'm doing okay? You can show them the list actually, and they can probably tell you that you might need a bit more time.